There's a whole other side to ENT, which is like head and neck cancer reconstructions, which is not small interventions, where they're doing things like free flaps, where you're basically removing part of someone's mandible because it's cancerous, and then you're reconstructing it with something like a fibular free flaps. The stuff that we do in ENT, it's really the range is humongous. So once you even choose a career in ENT, there's a ton of different stuff you can do.
Hello, everyone. I am so excited because we have Dr. Bradley Block here on the podcast. And I know I say this every week, but I'm really excited to chat. So I'm just going to give you an opportunity to tell us a little bit about yourself and your journey to medicine.
So my journey in medicine, I guess I didn't think I was going to be pre-med. I switched when I was in undergrad as a junior. I was like a bio type major, didn't know what I was going to do with my life. And I didn't have some inspired journey. It was more like, crap, I don't know what I'm going to do with my life. And medicine was like, oh, well, it gives you steps to a career. So like, it wasn't some inspired, like ever since I was a little boy, I always yearned to be a hero. No, it was like, I don't know what to do with my life. I guess this makes sense. Let's try it. And I also wanted to do something meaningful. I mean, I was, when I made the decision, I was studying abroad in Jerusalem at the time, which is, a super special city, and it really had an impact on me. And so, between not knowing what I was going to do with the rest of my life that far into college, and also having that type of environment and wanting to do something meaningful, that's how I ended up choosing medicine.
That's awesome. And I love your transparency because, as we know, there are many avenues to medicine, and everyone kind of, especially the students, I think, kind of feel like they're behind or they're doing something wrong if you don't know what you want to do when you first enter college, for the pre-meds who are listening, or if you don't have that story when you're applying where it's like, oh, when I was 2, I had my first stethoscope and pretended to do an appy while I was playing operation. So like there are many avenues, and you can even go and have another career and then come into medicine. So for the listeners out there, it's okay if you want to switch majors, or if you want to do a major that is not in science even.
Yeah. I mean, I think it would be encouraged even, so that, because you'll learn all the science in medical school. So don't worry about that. In fact, it's better if you learn something different so that you do have a little more depth and breadth to you. Not that I did, but you should.
Absolutely. You have to keep those things that kind of make you and yourself. Now, you ended up going into medical school and you became an otolaryngologist. And I love saying that word because it's so
just rolls off the tongue.
Interesting. But for those who may not know, that's an ENT doctor, ear, nose, and throat. So can you tell us a little bit about what led you to that decision of going into your specialty, and what's your favorite thing about being an ENT doctor now?
So I was all over the map. At first I was going into PM&R, right? Physical medicine and rehabilitation, also known as physiatry. And then, I don't know, maybe orthopedics. I decided not to go into orthopedics because I don't follow organized sports. I don't watch Sports Center. So I thought I'd be, excluded from all of the conversation. Now, in retrospect, silly way to go about making decisions, but there it happened. I really liked pediatric interventional cardiology because I really thought the physiology of pediatric hearts was really interesting. So I went through all of these things, and then during my elective, I ended up on ENT. I actually thought I was going to go into pediatrics, and so I chose ophthalmology as my elective because I thought eyeballs gross me out, and I need to get over that if I'm going to be a pediatrician and see like potential eye injuries and, drippy eyes and whatever. But I didn't get my first choice. I got my second choice, ENT. And I did my rotation. I was like, this stuff is so cool. So the thing that I like about ENT is we do these small, slick interventions that really make a huge difference. Now, there's a whole other side to ENT, which is like head and neck cancer reconstructions, which is not small interventions, where they're doing things like free flaps, where you're basically removing part of someone's mandible because it's cancerous, and then you're reconstructing it with something like a fibular free flap. So you're taking fibula and muscle and the skin that's overlying it, and you are putting that in their mouth and hooking it up to it. So like the stuff that we do in ENT, it's really the range is humongous. So once you even choose a career in ENT, there's a ton of different stuff you can do. But what I really liked was like the smaller interventions that make a big difference. And in my practice, I'm a generalist, so I see a bit of everything, but a lot of my practice is pediatrics. So I'll come in and, you'd think it would get monotonous, right? Because I walk in the room and I see one of these mouth breathing kids like, right? And I know immediately they've got big tonsils. They got big adenoids. They probably have fluid in their ears. I hear them coughing. A ton of them have asthma. And the parents come in and these kids are like a hot mess. And I'm like, I'm going to change your life, right? We're going to get that cough under control by managing their asthma. We're going to help them hear better by putting tubes in their ears. We're going to get them breathing better by taking out their tonsils and adenoids. You're not going to stay up because the parents stay up all night, like watching these kids having the apneic episodes over and over. And some of these kids are underweight because they can't breathe through their nose because it's so hard to eat when you can't breathe out of your nose at all. And so, we can make such a huge impact and they do really well. These kids do really well. So that's definitely my favorite thing to do in ENT.
That's amazing. And I love your enthusiasm. Like you can tell like when someone just loves what they do. And that's what we should seek, like the passion, because as you mentioned, you're going to do a lot of rotations when you're in medical school and all of them are cool. You just have to kind of think through like, is this something I want to do like for a very long time?
You got to be okay with the mundane. You got to be okay with the mundane. Like I remove a lot of earwax and it's never interesting. It isn't, but you got to find a way to enjoy. You got to find a way to enjoy the mundane.
Absolutely. I can definitely agree. I'm a primary care physician. And it really tickled me when you were talking about how you wanted to kind of conquer eyeballs, like even though you didn't go that route, because when I was working in person, my medical assistant knew that I hated feet. Like feet are not my thing. I don't. But as a primary care physician who treats diabetics and other things, you gotta look at the feet, you gotta touch them, all the things. So it's kind of like,
excuse me, can you take your socks off?
And be like, the socks are
Just
off.
I
talked to them. This is it. Okay, here are your gloves. So just kind of getting in the habit of those things.
Definitely. Yeah. One of the advantages of ENT, no gowns, socks stay on, everything stays on.
Yeah. And you guys will see like, send your patients to podiatry so when you take the socks off, there's not flakes like going everywhere.
Yeah.
So, yeah.
And then you breathe some of that in. Oh, man. Breathing in
that was
foot
a really
skin.
move.
Whoa.
I've done it a couple times and I learned my lesson. But you are also a podcaster. And on your show called The Physician's Guide to Doctoring, you discuss everything that we should have been learning while we were kind of learning the Krebs cycle and all the boring things.
Yep.
So if you were like the czar of medical education or something like that, what are 3 things that you think that every medical school should incorporate into their curriculum?
So, I think we should sit down with a family physician, right, and shadow them for the day. And then reflect on what skills this person needed in order to be able to optimize each of those interactions, right? Rather than, working from the ground up in terms of biochemistry and molecular biology and memorizing all these pathways that we never end up using. Or if we do end up using, we end up knowing because we use them so many times. Like we memorize them just by our endocrinology colleagues are memorizing the GLP-1 pathway right now because of, the medications that block that, right? So we don't necessarily, as an otolaryngologist, I don't need to know that stuff. So how come I'm spending my time memorizing some of this stuff? How come I'm dissecting the forearm in gross anatomy, right? Like, I'm not even sure they're still doing this, right? I did graduate from medical school in 2006. So it was a while ago now. So I'm not sure how much is being updated, but like, just sit and think like, what are the skills we need to be effective physicians? And one of them is communication, right? And we're taught all the time, like, you got to listen to your patients. You don't listen. Like, what does listening really mean? And how do you be an effective listener? Right? So that's one, is how to be an effective listener. And some of the ways that you can learn that is it's not about listening so much as about being present and undistracted, because the patients will notice if you're listening, but distracted, because both of those things can be true, right? But if you're present and undistracted, the patient will appreciate it more. And then listening, not just for content, but also for emotion. So you know how it's affecting the patient, right? Not just what their pathophysiology is, but what they're going through in dealing with that. So, we talk about being holistic, and that term has kind of been co-opted by the pseudoscience industry, right? Holistic. But like, if you're really going to be a holistic doctor, you got to be like looking not just at, looking at the whole patient. So listening, I think like learning how to really listen effectively would be one. Another one would be persuasion. Like, cause we're not just the stewards of the information. It's our job to find out what their health goals are and shepherd them towards those goals, because they might come in, like we learned very clearly during COVID, that we've lost the information battle, right? And so we have to win it person to person, right? If you're a trusted physician, right, they're going to trust you, but you still got to persuade them, right? How many conversations have you had about vaccinations now? And are we equipped to really have all these conversations and all the pushback that we get? No, because we were never taught the skills of persuasion, right? So I think that's another effective class. I mean, I could go on and on. Another one would be habit development. What are effective ways to start new habits and to break old ones? Fat metabolism. What difference does that make? Like, of the pathophysiology of how, the pathophysiology of diabetes is maybe not a good example, but, to use the citric acid cycle, right? The Krebs cycle, the example that I love, that everyone loves to hate. So knowing fumarate and malleate doesn't help me help a patient lose weight, but knowing how to effectively start habits and how to stop habits does help me help that patient. But we're not taught any of this stuff. And this is the stuff that's going to help us help our patients more. So that's just 3. I could go on because I do have a whole podcast of it.
Talk about more, but I couldn't agree with you more in terms of a lot of these skills that we fill the medical curriculum up with. We could either decrease the amount of time people are in school and taking on the debt, and we're losing physicians, so we could get people out into the workforce a little quicker with more training, or we could utilize some of that to kind of focus more on these soft skills, the skills that you need regardless of whichever field you go into. You'll need to know how to communicate. You'll need to learn how to listen. You'll need to connect with your patient and kind of help them get on board with the treatments and things that they need. So with some of these things, you can definitely work to figure out, like, how can we incorporate some of those things? I know that you do, and you talked about it a little bit, you do a lot of talks and things about better ways in which we can work on that patient-doctor communication. Do you think that that's a skill that people can learn, or is there a way that you suggest that people sharpen it besides just practicing?
Yeah, it definitely can be learned, right? Like Carol Dweck, the famous psychologist that talks about mindset, right? Do you have a fixed mindset or do you have a growth mindset? Like, it's like, some people are born funny and some people aren't. And the answer is no, like, you're not born funny. It's like you just got some positive reinforcement early on. And so you kept on trying things until you figured out what got laughs. And then it just kept on, propagating from there. Whereas someone else didn't do that. And then they didn't develop that skill. So it can be developed later in life. Definitely. Like, communication skills can definitely be developed later in life. And the answer is you need to be methodical about it. So you need to think about, like, what is one thing that I need to work on in order to be a better communicator? And then you work on it, not just in the exam room. You work on it in your life, right? Like being present, right? Being undistracted. Like, when I'm with my kids, I really want to be present and undistracted, and I need to practice that. So if I'm going to get better at it with my kids, then I'm also, by extension, going to get better at it with my patients, right? Get better at it with my friends. And who doesn't want to be a better listener? Who doesn't want to hang out with someone who's a really good listener, right? So this is going to help your social connections. And we just found out through these big longitudinal studies that that's a great predictor of health and longevity, is the strength of your social connections. Great. I just helped you live longer. How do you like that? All this stuff can be learned. I mean, are you going to be as great, as charismatic as, like, President Obama, right? No, I mean, we can't set our expectations to be like, I'm going to become one of the most charismatic people in the world. No, but can I improve upon my current status level of charisma? Absolutely, you can.
That is very great insight into how you can work on your different skill sets. Even like, it's like training, like work on it and you'll get better at it. And if you are actually intentional about what you want to improve on, you'll get better day by day.
Exactly. Pick one thing, work on it, iterate on it, pick something else, same thing, incorporate it in your whole life, and then it'll translate into the exam room as well.
Absolutely. So we're almost coming to a close on this wonderful discussion. I'm going to ask you a question that I love asking all of my guests because the answers are typically quite unique.
Okay.
So if you had a magic wand and you could fix anything about our healthcare system, because it doesn't really need to be fixed, what would you change about the healthcare system?
I think that universal healthcare needs to happen. Personally, I'm not a fan of single payer because I want there to be other avenues to get more money into the system for the people that are willing to pay more and can pay more for better services and more services. We should have an avenue for them to do so that money can also be spent on those who have less. So I think I believe in universal healthcare, but I don't necessarily believe in single payer. I think there should be some multi-payer system so that you can pay more into the system if you want, and then we can use that revenue in other ways and not just to line the pockets of, the 0.01%. So that's what I would do. I would institute and also I would, if I could do it with the snap of my fingers, I would completely untangle it from employer subsidized healthcare. So, how did we even get here? This is left over from World War II. When World War II and everyone went off to war and there was no one left to work, they were increasing wages. So there's a cap put on wages. So rather than, paying people more, which they couldn't do to try to attract them, they came up with other things like pensions and health insurance. And ever since then, health insurance has been tied to employment. So we need to have a universal healthcare system so that everyone has at least some minimal amount of care. And then you can buy more on top of that. And then we need to completely untangle it from the employer-based system. Because, to have it tied to your job and then you leave your job and then you don't have insurance for a couple of months until you find a new job. And then they don't want to give you insurance right away because you might just be taking their insurance to get like some operation. So then they're paying for that and you leave that job to go to another job. And it's insane that it's tied to employment. So yes, those are the two things.
I couldn't agree more. There's absolutely no fathomable reason why we are the only industrialized nation that does not have some form of universal health care. We spend the most money. We have a great fund. We should figure out how to allocate our funds in order to help people who need help. And it could save healthcare dollars if we actually worked on preventative care or treating people when it's earlier on instead of waiting until it's too advanced and then you have to write it off anyway. But that's my rant on that.
We have the information. We have the information to do that. People that live in food deserts, to be able to ship them fruits and vegetables, something simple like that can save all of us tons of healthcare dollars and save their health. And yet, our political system, they're going to be those who demonize that because they're going, well, you're giving people something for nothing. You're going to make them it's just, it's all broken. It's all.
Oh no,
broken.
I couldn't agree more. They love to tell us that we have to separate medicine from politics and all of that kind of stuff. But medicine is political. It's 80% of your health and your ability to live is outside of the healthcare system. So
yes.
2024, guys, you figure it out, you vote.
Yeah.
But
yes.
Yeah, I couldn't agree more. And then the part where you talked about your healthcare being tied to your employer is one of the reasons why I think we don't have a lot of innovation and all of the other things, because people are afraid to leave work because of certain things. And
right.
Your ability to live should not be determined by your employer, because even some employers, they give you just the bare minimum, these corporations, Walmarts, the gas stations and things like that, they give you the bare minimum so that they can say that they're offering you insurance, but you really don't have anything and you have these high bills. So we have to do better.
Or in Walmart, I heard Jon Stewart talking about this. Walmart, a lot of their employees are on Medicaid. So we're actually spending money on Walmart's employees to give them health insurance. Mm-hmm. And therefore, that money that's being saved by not providing them with health insurance is going into the pockets of the investors. So how broken is that system? And I love the point that you made that it's going to help the economy. It's going to help the economy move if people have the ability to change jobs. We're holding the economy back by tying healthcare to people's jobs and preventing them from being more fluid in their transitions. So that's a great argument for untangling it from the employer-based system.
Yes, a job's benefit or plus or positive aspect shouldn't be like, oh, they offer health insurance, they're dangling that. Like, be competitive in other ways. Like that should be the basis. But it was such a lovely discussion with you. I hope that the listeners found it valuable. I think that it's so important for everyone to think about some of those softer skills as you go through your journey in medicine. Yes, you will learn all of the different things. You will learn all the pharmacology. You will learn all of the different parts of the body and the anatomy course and all of those different things, which you do need to learn. But the part that will take you the furthest.
Do you though? Do you?
Well, I've forgotten them all by now. So you need to learn them so you can match.
You need to memorize them and then probably forget them. Yes.
Learn them so you can match. But then the things that continue to follow you throughout your career are those things like building relationships with people and having the ability to get your point across and be persuasive to help people, because we are not working in an authoritative kind of paternalistic environment anymore. So we need to partner with our patients. So it's just very important. So I love all of the things that you shared in your words of wisdom. So I'll just give you an opportunity to tell our audience where they can find you and say goodbye.
Wait, does that mean if you didn't appreciate my words of wisdom, then you wouldn't give me the opportunity to share where?
I'll just cut it right off.
So you can find wherever fine podcasts are sold, right? Just check me out. Look up Physician's Guide to Doctoring. I've got tons of back episodes on basically all the stuff that we talked about today, from politics and persuasion and all the soft skills and personal finance, lots of stuff. So everything, as the tagline goes, that we should have been learning while we were memorizing Krebs cycle. And you can check on my handles at Physician's Guide on Instagram, on Threads, on Twitter, and then Physician's Guide to Doctoring on Facebook. And check me out, leave a nice review, and don't forget to subscribe.
Definitely look and subscribe over there. And for the listeners out here, we're on YouTube now, so you can go and check us out under Med School Coach. If you have any suggestions of any guests or topics that you want us to talk about, you can reach out on my Instagram at Dr. DGram, DOCTOR, the letter DGRAM. And I'll see you next week with another fantastic guest. Bye.
Each episode of the Prospective Doctor podcast is brought to you by Med School Coach. To access articles, videos, webinars, and free tools to help you succeed on your journey toward medical school and beyond, visit our website, prospectivedoctor.com. We hope you tune in again next time.